You can call me Sunny, and I'm here to help you heal yourself and heal others using free tools uh, like functional medicine. And so this is a for those people who are wondering, what is functional medicine? Should I find a functional medicine doctor to help me in my health journey? So basically, this feels like functional medicine is the evolution of the practice of medicine because it's trying to take the whole person into account, mind, body, spirit, what's happened to them in the past, what their habits are now, and not just addressing an isolated set of symptoms. I've been a family doctor for a long time, and what you would do is you would put people, when you listen to somebody as a family doctor, you kind of want to hear what they're saying and put them into some kind of a box so you can either give them treatment, usually with medication, or you can forward them like an email, forward them to someone who can take care of them. Now, the difference when I'm listening to someone as a functional medicine doctor is most functional medicine doctors are able to spend more time with people, and we really need to hear the life story. Actually, we really need to hear all the things that have gone on so we can think about what we call root cause resolution. Because if you have a lot of symptoms, something is causing the symptoms. And with my original conventional medical training, which I still use, I mean, I still use my brain, right? I use all the things I've learned before, but now I think about it a little differently. I look historically at what's happened in a person's life, when things started, when they were exposed to different things, and then try and put it together in a way such that we can identify treatable root causes. These days, the conventional system is very focused on acute care, curing things that have already diseases that have already taken root, right? And we really would like to pull out those roots before they dive deep, so that you are basically weeding the garden and eliminating issues before they become problems. All your symptoms are little red flags that are being thrown. Many doctors right now who are practicing don't realize that there is a big gap between up to date, between emerging research and how we practice medicine. And this is most specifically true in the area of complex medical illness. When somebody comes and has lots of symptoms in lots of different areas, many times this will lead the conventionally trained medical physician to think there's a psychiatric issue, which, something that happened with me. And, they were well-meaning, thinking maybe there's some depression going on. I was not depressed. I just felt terrible. And so with this, in the new dawn, I mean, I would say that the presentation of patients over the past decade, 20 years, has really changed. Many times people are seeing in their offices, no matter what kind of practitioner you are, you're seeing people who feel generally worse and have lots of symptoms. And so what we want to do is apply as many natural methods like nutrition, movement, mind-body based interventions that have no side effects, that can help people get better measurably, and then also use a combination of an integrative science-based healthcare approach, where we're looking upstream at everything that's happened. We're looking at someone's genetic makeup, looking at their exposures, and combining best medical practices. So the question, and that could look like a lot of things. It could look like a yoga class, right? As one of the interventions. It could look like an herbal medicine. When we look at Germany, most of their prescriptions are herbal medicines in Germany. Interesting, right? Germany is the seat of homeopathy and these other kind of natural ways of treating people. And also, does functional medicine work? Well, there's a great study. Cleveland Clinic did a study looking at outcomes, showing people had improvement on quality of life scores using functional medicine. So should you consider it? I think that it is, if you have the ability to find one in your area, there's not a lot of functional medicine doctors yet, then it's very reasonable. If you've been trying and doing what your physician or your naturopath tells you to do and you haven't yet gotten that boost in your health that you're hoping for. If you are like, well, there's nobody around me, around my area, that is why I'm here doing this. And and if you email me, clinic@feelgoodfunctionalmed.com, I can send you something that I consider a starting point for functional medicine. And that's creating a timeline. Okay. So if you're wondering what is the first thing a functional medicine doc is going to do when they get you in their office, well, they're going to listen to your story and they're going to create a timeline of your life, right? And actually, it's going to start with what was happening with your mom when she was pregnant with you. Okay, because now we know things that happen in stressors in pregnancy can set us up for things like diabetes later in life. So we would start off with what happened and what was happening in your family with your mom when you were in utero, and then you can go kind of methodically through this. You might take a piece of paper and make a timeline of your age and when you lived where. Okay, I would start off with where you were living when you moved. Okay, because environmental things from your house can actually make people feel sick. If you didn't know, oh, surprise! Oh, hate to say that, but so where did you live? What were you doing during those periods of time, like for work, for hobbies? Hobbies are important because sometimes hobbies can expose people to toxins. For instance, maybe you started to feel bad during your stained glass period. All right, people can have significant lead exposure and psychiatric, so many issues from lead. But so what were you doing? What were your hobbies? And and then when did symptoms start? When did symptoms end? So you're looking at your whole life. Are there any exposures? Were there hospitalizations, surgeries, stressful times in your life? So you want to gather as many data points as you can on the timeline. So you may be able to start to see connections, even if you've not been trained. Now, if you're a physician who's like, oh, I want to do this, but I don't know how I would possibly put doing a timeline in with people, well, that's why we have like this course, which is available in my Energy for Life, which is free when people use phototherapy patches that I suggest they try for energy. Ooh, ooh. So they can come to this course and they can fill out a timeline, and we can walk you as a provider, your patient, through what would the basics be if they went to a functional medicine person. Because it's true, practitioners in general, they don't have time to really dive deep into a timeline with a person. And then we can talk about how to evaluate your timeline. In fact, that's what we will go through in the next module in this course. I'm going to give you guys a timeline, and then I want you to fill it out, right? You got to do this with a cup of tea or something. Take your time and fill it out so that you capture as much data as you can. And then we'll talk about how to analyze your timeline and what are the common things that we're looking for as providers to try and come up with what sort of root causes may be going on for you and what may be hidden. So that will be in the next. Analyzing your timeline is the next lesson in this course. And, it's therapeutic when somebody listens to you. And that is the value. So a provider, you could actually have somebody fill out a timeline before they came into you. And if you had an extra 5 minutes that you could look at it and say, all right, it looks like over your life, you've had significant things go on. Everybody wants to know that they are significant. And these events that are meaningful for them are also important to their providers. So it is therapeutic just to hear somebody sort of recount your timeline. And that is a powerful intervention that you can utilize when you're talking with your patients. So if you're in the Energy for Life, in fact, in my YouTube, if you're watching this on YouTube, what I'll do is I'm going to go back there and I'm going to input a link where you can go and find the timeline that you can utilize. And it's pretty pretty straightforward, right? You fill it all in. But when people are hearing their story back, they will walk away from a interaction as a practitioner with you, feeling like you've heard them, and it will make you feel good too. You'll feel what I call angel wings in the air, and that's those little tingles when you've said something that's connected, it's made somebody feel good, feel valued. And so I hope that's helpful to you. And if you're interested, clinic at feelgoodfunctionalmed.com. I'll give you more details on how you can utilize some free resources for yourself if you just want to try and go through yourself, or if you'd like to do it with your clients and somehow start to work in a little bit of functional medicine. All right, you guys, big love. Have